Hi class, my name is Amber Creed. I've worked together with Trevor Deacon and Irene Prestridge to create this presentation about typhoid fever. I will be discussing the etiology and history of typhoid fever. Typhoid fever is caused by the bacterium Salmonella enterica typhi. It is a gram-negative bacteria, so it appears red in the gram stains. It is rod or bacillus shaped. It is motile. Its size ranges from 2 to 5 by 0.7 to 1.5 micrometers. Like other gram-negative bacteria, it has an outer membrane, which is a lipid bilayer. Of note, it contains lipopolysaccharides, which act as endotoxins that result in a high fever and toxic shock. Its cell wall has a thin peptidoglycan layer, again like other gram-negative bacteria. Its cell membrane is, as would be expected, made of a lipid bilayer and proteins. Also to be aware of is that Salmonella typhi does have a capsule outside of its cell envelope, which is unusual in gram-negative bacteria. This capsule protects the bacteria from phagocytes in the immune system, which would try to destroy it. It also has flagella, which are peritrichous or randomly placed all over the rod-shaped bacteria, which make it motile. Typhoid has been around for a very long time and has killed many people throughout history. This continues to a lesser extent today. Some historians believe that typhoid was responsible for a plague in Athens, which killed 1/3 of the population. Historians also believe that the settlement at Jamestown, Virginia was wiped out due to typhoid. In 1838, William Budd noticed a poison in excretions and suggested isolating excrement as a way to stay the disease. In 1879, Carl Joseph Eberth described the bacillus. In 1896, the first effective vaccine was developed by Almroth Edward Wright, but was only to be used for military use. Those in the military were more likely to be killed by typhoid than in combat. Between 1907 and 1915, a lady named Mary Mallon, nicknamed Typhoid Mary, was unknowingly responsible for spreading the disease in New York. Irene will tell you more about her later. In 1911, the first vaccine became available, and in 1948, the first antibiotic treatment became available. Now, just for fun, the reason that I became interested in presenting on typhoid was from my recent exposure to it in book form. I'd been reading a book to my children that had made an impression on me as a child. Christie is a historical fiction novel written by Catherine Marshall in 1967. It tells of a young woman named Christie who went into the Smoky Mountains to teach school in a poverty-stricken area. An epidemic of typhoid strikes, and the devastation that follows is saddening. This is a quote from the novel. "I would not have believed that the base of our lives could change so quickly, but then neither had I known before what the dread word epidemic stood for. Scarcely a family left untouched by the disease, sometimes with no one left to cook or care for them." In the book, the symptoms of typhoid are described, including hallucinations and the covering that develops on the tongue.
Hi class, I'm Irene Prestridge, and I'm going to cover the reservoir and transmission of the disease-causing bacterium Salmonella typhi, better known as typhoid fever. First, let's review what a bacteria reservoir is. According to our textbook, a reservoir is the primary habitat where the pathogen originates. So the CDC reports that in the case of typhoid fever, the only known reservoir is humans. No animals or environmental reservoirs have been identified. People that are ill with typhoid fever carry the bacteria in their bloodstream and intestinal tract. A small number of people can recover from the illness but continue to carry the bacteria. These people are called carriers. Both those that are ill and those that are carriers continue to shed the Salmonella typhi bacterium in their feces. So carriers are important because they continue to spread the disease without knowing it. So precautions are overlooked. So here are the different kinds of carriers. First, we have the asymptomatic carriers. These are people who are infected but show no signs or symptoms of the disease. Mentioned earlier, Mary Mallon was the first known carrier in the early 1900s. She was an Irish immigrant that was hired as a cook for a wealthy New York family. After several of the members of the household came down with typhoid fever, an investigation was started and traced back to her. Her life was never the same after that, and she was nicknamed Typhoid Mary. She lived her life in and out of forced quarantine. When she was released from her imprisonment, she was ordered to never return to work as a cook. But when 25 people at a women's hospital came down with typhoid fever, it was discovered that she had returned to cooking under the alias Mary Brown. She was immediately put back in forced quarantine. Okay, now back to the next one, infected carrier. These are people who are ill with the Salmonella typhi bacteria, experiencing the signs and symptoms of the disease. Then we have convalescent carriers. These are people that are recuperating and have no symptoms, but continue to shed the bacteria, making it possible to infect others. Then there's chronic carriers. Even after treatment with antibiotics, a small number of people, after recovering from typhoid fever, continue to harbor the bacteria in their intestinal tracts or gallbladders, which can go on for years. Salmonella typhi has shown a preference for the gallbladder and colonizes the surface of the gallstones, which is how people become long-term carriers. Okay, now we'll move on to transmission. Let's review what is meant by transmission in the context of infectious disease. Transmission is how the disease is spread from one person to another. Since we've already determined that typhoid fever is only passed from person to person, we will discuss the different ways it can be spread. You can get typhoid fever by eating food or drinking a beverage that has been handled by a person that is shedding the Salmonella typhi bacterium. This is what made Typhoid Mary and her job as a cook so deadly. Consumption of food or water that has been contaminated by feces and urine containing the bacteria. This happens most readily in areas with poor sanitation. Then transmission through sexual contact, especially men who have sex with men, has been documented, but is rare. Now let's move on to the different forms of transmission. First we have direct. This is when contact is made between an infected person and a non-infected person. This can be in the form of touch. The infected person who does not properly wash hands after using the bathroom can transfer the bacteria onto objects that are then touched. The indirect route is these inanimate objects that infected person has touched. Then there's water, soil, and food that all can be infected by feces and urine containing the bacterium. There's a special category known as the oral fecal route, which is when a carrier with inadequate personal hygiene contaminates food during handling and the recipient ingests it. Again, Typhoid Mary lived in a time when hygiene practices were not very good. Another way is the person contaminated with fecal matter touches their mouth, leading to ingestion. There is one other mode of transmission that is the vector transmission. Mechanical vectors include insects that carry the bacteria on their body parts, spreading the bacteria in this way. In the case of Salmonella typhi, the vector is the fly. Flies land on contaminated waste and carry the bacteria on their body parts, spreading it to whatever it lands on.
Well, I'm no doctor, but here's what you should know about the signs and symptoms of typhoid fever.
How do you know when you have typhoid fever? You might experience fever, headache, weakness and fatigue, sore throat, rash, bloated abdomen, discomfort in abdominal area, loss of appetite, confusion, unable to pay attention to things, constipation, or less commonly, diarrhea. In case of these symptoms, take the day off and mark a visit with your doctor. If the above symptoms remain untreated, a patient will likely experience diarrhea, which will be noticeably foul-smelling. However, get up and have someone drive you to the hospital if you enter what is known as a typhoid state. Typhoid state is when the subject lies motionless or completely exhausted with the eyes half closed. If such is experienced, or if you or your subject becomes delirious, seek immediate medical attention. So typhoid sounds fun, right? What can you do to avoid this disease? Developed countries such as the United States and Canada offer vaccines for typhoid fever. Developed in the early 1900s, these vaccines have two forms. The first is an oral vaccine, taken in the form of 4 capsules taken every day. Got that? 4 capsules every other day. This vaccine lasts 5 years before requiring a renewal. The second option is by injection. This goes without explaining and lasts 2 years before a renewal is necessary. Why someone would take a less effective shot over a few longer lasting pills, we'll never know. If typhoid fever is contracted, remain calm. Antibiotics are available for treatment. In addition to antibiotics, the following habits aid in treatment. Drink plenty of water, and sports drinks can help in cases of heavier dehydration. In extreme situations, an IV solution may be required to treat severe dehydration. A high-calorie diet with lighter foods. This means no steak and go easy on the cheese. Typhoid fever is usually curable in 2 to 3 weeks, and less than 20% of patients experience relapse. To avoid contamination, wash your hands well after using the bathroom, and the bacteria is present in stool and urine. Also, quickly treat any suspected cases.